So welcome to Break the Mould with Anwyn. I'm joined today with philipktkim, who is a registered music therapist. Welcome today.
Thank you.
So for our listeners, could you explain what music therapy is in a nutshell? So
It's a really, go on.
Oh, yeah. So I had a little look and it says that it can help with a lot of different people. So it can help with injury, illness, disability. So, yeah, maybe expand on that.
Yes, so I think the question is big because of that reason, in that we can work with lots of different people towards different goals.
Mm,
And in all of those different contexts, the sessions that we run might look very different from one another.
mm,
But I guess the kind of textbook way of describing music therapy is that um, it's an allied health profession that's research based, that uses music and all of its opportunities that it presents to help people reach goals that might fall into the domains of like function or well-being, um, social connection, um, disability, like rehabilitation, that sort of thing. So it
mm.
covers a lot of areas.
Yeah. And so who refers you your clients? Who would it be
So
that?
I'd say, so um, for myself, I'm working a lot um, with kids in primary schools. So I have been a teacher for the last 10 or so years. So naturally got a bit of a network where I'm based um, with schools. But also, yeah, referrals can come, I guess, from other therapists like occupational therapists and things like that who see an opportunity for um, someone that they're seeing to access these different types of therapy that could be helpful. Could be from doctors, from teachers saying, I think these groups of kids seem to have a particular need. And yeah, obviously, in our context in Australia, there is also a big funding stream through the NDIS.
Mm.
And so people self-refer as well. If they might see that music therapy is listed as one of the services that they can access.
Oh,
And
yeah.
so they might reach out to a music therapist themselves if they like the sound of it or if they want to find out more, sort of thing.
Mm. Yeah, so it's a huge range, isn't there, of different areas. And so then, and I also read that there's four main methods. So receptive, recreative, improvisation, and composition. Do you utilize those?
Yeah, and they're probably more straightforward in a way. Like they're things that everyone does to a degree, but it's they're really nice broad categories for us to I guess be able to describe the four main ways in which we work. So receptive describes taking a participant through a listening experience, and that can look a lot like mindfulness and meditation and imagery type work, or maybe it's just music for people to relax and regulate to, and that sort of thing. Improvisation is exactly that, where we're creating music spontaneously together. And obviously, there can be crossover between all of these. Like I might improvise a piece that someone is purely listening to, and that would be also receptive. Composition encapsulates writing songs together, and that can be like to take a song that already exists that someone really loves and rewriting some of the lyrics to make it more relevant and personable.
Oh,
or
wow.
yeah, we might write a
That
song
sounds
from
cool.
scratch. And
Mm.
yeah, and it could be that kind of I guess depth work where someone is trying to express parts of themselves that are difficult to do sometimes, and just in conversation. But it can also be really lighthearted in terms of working with kids, and if they are at the stage of trying to get a bedtime routine happening, and you might have a song that transitions them into their routine, or reminds them of the
Mm.
steps that they need to take to brush their teeth, and
Yeah.
all of that sort of stuff.
Yeah. So we call that anchoring with NLP, where
Yeah.
and music, is very powerful in that respect, isn't it? And that's also what I was reading, was that then sometimes music could trigger people in certain ways. And so, like, it was suggested that maybe PTSD is not recommended. Would you say that's something that you know about? Like
Uh,
music therapy for.
I wouldn't be able to speak.
Mm,
I wouldn't be able to speak personally about experiences
no.
of working with, um, I guess, participants who have a PTSD background. But I do know that music therapists working in the space of in a trauma-informed way
Yeah.
is a really growing field, and
Mm-hmm.
it is an area that we're employed a lot in.
Mm,
So things like uh, there is a big rehabilitation, a mental health, adult mental health centre in Melbourne that music therapists work at, as well as in hospitals. And um, I'm not sure about kind of the notion of kind of putting a bracket around
yeah.
that diagnosis and saying music therapists shouldn't work with them. I would probably agree that there is greater care to be taken, but
Yeah.
I would say that about, you could pick an aspect of each, I guess, grouping of people in terms of what sorts of things that a practitioner would have to look out for.
Mm. And you would probably work out that over time, like a program for that individual person, in any of your therapy. It wouldn't be straight away. Is it?
Yeah, and I guess it's what we might be touching on is the fact that um, just like anything else that has been created for good and is supposed to be good for you, um, it can be it can also be dangerous sometimes, or well, not necessarily inherently dangerous, but it could
Mm,
lead to um, unhealthy uses of music, or it could be like the music could be the trigger to go down into to spiral into behavior that isn't very helpful. But it's sort of like there's certain medications that are helpful for people, but it can also be abuse, sort of thing. And so just like that, and it's not a perfect analogy, music therapists are trained to also look out for unhealthy patterns of using music and unhealthy associations that may pre-exist, and kind of working around those different issues as well.
mm. Well, that's interesting. So is there a certain genre or that you use? Like, would you use ever loud music in music therapy?
Yeah, it just really depends. It's a joke
A case by case,
that the lecturers always say.
of
Yeah,
course.
because any questions that we as students had, um, the answer would always start with an "it depends."
Yeah.
And yeah, you might find me parroting that a little bit during this
Yeah.
interview, and it can be frustrating, but you probably understand why that is the
Yes.
case. Like,
Yeah. It can't be
you really have
a
to.
blanket rule.
Yeah. Like if there was a blanket rule, there'd be some questions raised probably about, um, how deeply we're really looking into things. Like it can't really be the case that if you listen to Beethoven's Fifth Symphony or something, that's going to be the cure-all for everyone, then
Yes.
we'd all be good. We'd all be fine.
Yeah.
But we're not.
Yeah. Yeah. And so, so what does it do to your brain, like, when you have music
Hmm.
therapy?
I guess the kind of broad way of putting it is that it can really stimulate the brain, and it can do it in like a multi-layered way, that you're really promoting like the connectivity of different parts of your brain. There's a lot in music in terms of listening and processing and also engaging with it. So if we're hearing it, that's obviously the oral stimulation, and then you process that. And if you're having a move in time with it, you need to be able to feed forward in terms of anticipating when that beat's going to fall. So, if we're clapping, we might have to recoil our hands back, and then we're going to clap in time with the beat too. So that's all the movement side of things as well. And then we're listening again to whether we were in time and adjusting our movement.
Mm.
So yeah, I
You would say
guess
that's
that's just
cognitive
one example.
and motor skills. And
Yeah,
so
and
that's the
that's
physiology, isn't it? Yeah.
yeah, I guess when you brought up brain, that's really the way that I would channel talking about it. But it's really a lot more than that, isn't it? Where, there's emotional response to music as well. Like
Mm.
the answer that I just gave was a very, very functional, physiological, response, I guess. But there is so much more as the human um, that goes beyond that, where, hearing a song that reminds you of a song that your mother sang to you every night before you bed or something, it can
Mm.
touch on different emotions. And we've had, I'm sure a lot of listeners would have had lots of um, personal experiences of listening to a song and having physiological reactions and not knowing why as well. Like their
Mm.
heartbeat might increase, or they might have the hairs on their back of the neck stand up. Um,
Yes.
So there's a lot going on, and I would definitely not pretend to be the expert in terms of the neurological side of things in its specifics. Um, but what we do know is that because of the promotion of the connections of the different parts of the brain, that's how some people um, try to explain how, say, for example, someone with a stammer, um, when they're just in normal conversation through a song, they can speak their entire song without having a stutter. So yeah, there's
Yeah.
those sorts of things.
Interesting.
There's people with gaits in their walking. Maybe they've been in an accident and they're rehabilitating their walk, and when they walk to the music, their gait is significantly reduced, and they're able to walk in time with that the music as a stimulus as well.
Mm. Mm. Okay. So when would you then suggest that they listen to music while walking, for instance, for somebody like that? Like when they go for a
Yeah,
walk?
definitely.
Yeah,
Yeah,
as
so that's a great advantage of some of the technologies that we have now. Like it's in everyone's pocket. So
yes.
as if someone was having, let's go back to that example, um, with the music therapist, you could devise a playlist for maybe different um, purposes of walking. If you're out for a brisk walk, you're probably going to walk at a faster pace. And so you want a song that's going to lock in with the right beats per minute to get you at that walking pace. If it's too fast right from the start, you probably won't be motivated too much to do it. Like you really want to match where you're at and then bring you up to speed and that sort
Oh,
of stuff.
yeah.
So we might devise that together and really talk about what sort of songs are motivating for you, what gives you energy, all of that sort of stuff, and we can curate something, and then they might be able to use that in their everyday practice to go out for a walk and things like that.
Mm. And so is it only used for individuals or can it be used in group situations?
No, a lot of the I guess the development in music therapy is leaning more towards group, if anything.
Mm.
Um, yeah, I think traditionally it's been more one-on-one based. I think that's been the notion of therapy historically. Um, but yeah, a lot of things are moving more towards group-based learning. There's yeah, I guess there's lots of things happening within society too that's not necessarily run by music therapists, but have that I guess using music as therapy element to it, like community choirs. And then yeah, I mentioned before there was the adult clinic for mental health patients, and they do a lot of group work because a lot of people will present with similar types of um, with diagnosis. So then if you have a group, a cohort, then you can really
Mm.
take them through together. And there's lots of studies to show that the efficacy of a group being able to lean on each other and learn
Mm.
from each other's experiences as well.
Social support as well.
Yeah, yeah. And I think when we say that, we often imagine like someone just being supported socially. But I think we shouldn't underestimate the opportunity for someone to be a support to someone else too. So when someone else opens up and it's almost like when someone else talks about their thing, another person feels more comfortable to share
Yes.
about their thing suddenly because they're talking through someone else's experience. Whereas it's actually a lot harder for the person that's been put on the spot. It's your turn now, and then but other
Mm.
people get to go through their turn too. Yeah.
Yeah. And the experience of having experience the music together, like you can probably all take something different away from it, but you might have some similarity, some, you know, shared experience there.
Yeah, that's a really great point. That would be probably the kind of ideal point that we want to get to with improvisation. Like if we can improvise as a group and talk about our own experiences and what we went through, what we noticed, it can be really fascinating.
Mm.
What sort of discussions can arise from everyone just making music together, but it brings up such different emotions um, and things for people. Yeah.
And so it can be a combination of like using a musical instruments because you're a trained music teacher. So you're quite good at playing a lot of musical instruments. So you can do that. You can use musical instruments, or you can use recorded music, and like you suggested, you could compose music as well.
Yeah, so I guess to become a music therapist at the moment, there is a sort of like a threshold to entry for people to study it. And they do that by kind of yeah, I guess stating the baseline of musicality that they should be at. They
Oh, yes.
mention like yeah, grade 8 A, maybe level sort of thing, but it's not as rigid as it sounds. They're actually trying to move a little bit away from, I guess, it's a very classical way of saying your standard, and lots of people are trained in different ways too. Um, so yeah, I guess as music therapists, we're all expected to have the toolkit to be able to um, play proficiently enough and have enough musical theory that we can do those things where we're writing a song and or helping someone write a song on the spot or being able to play along with people. And um, yeah, it's probably not uh, the number one thing that makes someone a great therapist, to be perfectly frank, but it is nonetheless a really important part of what we do.
Yeah. I could imagine that creativity, that side of it would be important. Yeah, with the
Yeah, and the connection that can foster, I guess. There's no point in having someone who can be super creative if it's just gonna feel daunting to the person that's actually trying to
Oh, yeah.
access the service.
Yes. Yeah. Okay. So is that part of it? Is it that they are actually involved in the creation of something?
Yeah, maybe there's been a lot of assumptions in terms of me skipping over things. But yeah, this is a good opportunity for me to actually say that to me, what happens in the therapy space would mostly hinge on involving the person and allowing them to have a say in what they would like to do
Mhm.
within the sessions, and being able to say, this, I would like to try to do it this way, and having input in the sessions. Like, we try to, as hard as it is to break away from completely, we try really hard to be conscientious of, I guess, that power dynamic and trying to neutralize it a lot more. Like, in our training, we talk a lot about, yeah, challenging that notion of us having to be the expert that leads a session and having to know what's best for the person.
Mm.
Um, that can be really helpful for people if that's the stage that they're at, and if that's the help that they're requesting. But I think in our studies, when we delved into it enough, a lot of us, myself included, came to the point that a lot of the times that's not what people are after. In fact, it's the very thing that might be making them feel like they have an affliction in life, is that they don't have a say.
Uh-huh. Okay. Yeah. And so do you think anybody can create some music?
Yeah, I think we just have to be creative with what we mean by music.
Okay. Yeah. Just tap into it. Yeah. Like that feeling of connection with
Yeah.
sound and rhythm.
Yeah, yeah, exactly. So I think sometimes it can, and it depends on the person. Someone can pick up a tambourine and like really go nuts with it. And someone else will pick it up and go, "Don't treat me like a child." What
Right.
do you want me to do with the tambourine, sort of thing. So yeah,
Okay.
and I think, yeah, that's why, I guess, going back to one of the first points, it just can be so different what happens in a session.
Mm. And so what brought you to music therapy?
Um, it was a combination of, I guess, I think I would like to speak more on uh, um, the things that drew me in about the profession, about how um, how I was inspired by working with music to help people. And that's all true. I definitely was. I was driven to really delve into the the affordances that music has. And I feel like, yeah, it's something that I've had with me all my life. And I feel like I got to know people through my teaching practice. And so then I really saw an opportunity, I guess, in terms of being able to use music, something I know really well, to then bring it to people who um, might not see music as their main avenue to help deal with whatever is going on for them. But we can introduce that to them. But to be perfectly frank, another massive part of it was that um, I was really happy with teaching, and um, I could see myself doing it for a long time, but I really didn't want to. I wanted to kind of break away from that feeling of just being a teacher for a long
Mm.
time. I love teaching, and I'll probably go back to teaching at some point, but um, I wanted to try something different as well. And so COVID really made me consider what I really want to do, and
Mm.
I decided that if I just stayed teaching, I would probably be fine and be quite happy, but I think I would feel more fulfilled by learning this other area and trying to retrain. And yeah, I am very, very glad that I did it.
I definitely have like positive triggers when I hear certain music, and I think that that's the beautiful thing about music, is that it communicates in a subtle way. I think it's some like, I'm actually personally, I love lyrics. Some people say all I listen to is the music. I don't care about the lyrics. It doesn't matter what they are. But if the lyrics are funny or not right, and then I won't like the song. But yeah, I think that it's a very powerful way to communicate, because it's kind of subtle, and you have your version of it in a sense. Um, and so it touches you on an emotional level. And so that's something that is helpful with music therapy, would you say? On an emotional level.
Yeah, I think the major advantage is that most people have some sort of connection or an association with particular bits of music that we can probably tap into in a useful way. So yeah, I think that's kind of what you're saying about the
Mm,
connection to music that people have, that makes it motivating, really. That's
yes. Yeah,
at the
music can be
center
very
of a lot of
motivating.
it. Yeah, yeah. It's kind of um trying to break away from um like prescriptive, like you need to do these things to improve. And then for a lot of people who are struggling, it's very hard to do things that aren't rewarding. Um, and I guess, I can't speak for everyone, but it does seem to be that a lot of people inherently find music that they like to be quite rewarding.
Yeah. Yeah. And you get that the release of dopamine, like listening to good music, can make you feel very happy.
Yeah, yeah.
Like when you say a
In the right moment
reward.
with the right people, especially.
Yeah.
Yeah.
Yeah. And so how do you think music therapy helps with relationships with people?
Yeah, I guess we were just starting to get to that with that last point of so many of people's musical memories, I think, happen in relationship to somebody else.
Mm,
Um, whether we've heard it together with someone, whether someone was performing that to us, whether we went somewhere to watch it, whether it represents a certain stage of our life that reminds us of the people that were there at the time. Like,
yes.
I think it's very hard to isolate music as only being a personal thing. I think lots of people have just a personal connection with music that exists within their own mind too. Um, but yeah, I think just because of how much of it is around as well, there's so many memories that are associated with musical moments that it's very hard to remove from relationships. And um, I work a lot with younger kids and parents. Um, and sometimes the goal is to work on the mother or father child kind of relationship. And I guess music provides a lot of safety if that's one of the underlying goals that we're working towards, because a lot of children's music is predictable. We know where it's going, we know when it's going to stop. And so people can feel confident within the music. The parents feel like they know how to interact with their child through that music because everyone knows those tunes. It's easy to be playful with the music once it has that structure as well. And there's just so many elements you can throw on top of it, like actions and changing up different words and trying it faster, trying it slower, and trying it as pretending you're an elephant or trying it pretending you're a chipmunk. Like it's just, yeah, I guess so many elements of music that can be manipulated through communicating and, being in relationship to other people with the music. So yeah, I'd say it's huge, basically.
Yeah. Seeing a child, would you have the parents in the room too, or at the start, or?
If it's the goal, definitely we would try to do that. And again, there's no point in like forcing someone, not that you can ever force someone, but like, really pressuring someone to be a part of a session. If they don't want to do it, then
No.
it would be better off to not.
Okay.
But
Yeah.
oftentimes, if you're working with kids and the parent has gone out of their way to access the service for their kid, and if they can also agree that one of the goals to work on will be their relationship together, most of the time they will want to be a part of it. Um, but yeah, I guess for us as well, as music therapists, we're really interested in not just what happens within our session. So for us, it's worth way more if, like, let's say a caregiver, if we're working in the disability space, or the parent or the guardian who works with the kid a lot, or even the teacher, if they can witness these things and use what's happening in our sessions as a resource,
Yes.
that I think will have much better outcomes than just, again, working on an island just in our sessions.
Mm. In your personal life, how would you say music has impacted your relationship, like all your relationships? What has it given you?
Well, yeah, I would say, I guess it gave me an identity to begin with. I think, yeah, there's been lots of studies and stuff showing how crucial music is for the development of especially teenagers and their
Mm.
identity. And I'd say that was certainly true for me. Like I always identified as a musical person and being in bands and
Yeah.
um,
Were your
had
parents
friends that
musical?
were always in bands. Not really. They like music and
Mm.
they started me and my brother off on music early, but I also just kept asking for all these different lessons and they weren't really ones to say no with those types of opportunities. So I'm very privileged in that they allowed me to kind of follow my nose and have a go at a lot of different instruments. Um, and then I guess once that personal identity was formed, and I was definitely a part of like the rockers, like we all just loved rock music in our friendship group, and so that was a huge influence on the way that I grew up and the music that I was exposed to. But yeah, since then, I guess it's been, yeah, I feel like some of the most pivotal moments of my bonding experiences. I've moved a few times in my life, and whenever I have kind of moved, um, the kind of experience of really breaking through the convenience friend threshold into close friend seems to revolve around some sort of musical experience, whether you went out to a gig or you went to a festival or something like that.
Mm. Well, back in our day, what used to happen was somebody would make you a mixtape. Have you heard
Yeah,
of
well,
that?
I
Yeah, a cassette
definitely,
tape. A cassette
I
tape.
remember doing that.
Oh yeah.
Yeah, I definitely did that for some people in primary school, and
Oh,
I remember being
how
given
cute.
mixtapes as well.
Yeah.
Yeah, mix CDs were a big thing in my teenagehood. We did mix CDs.
Wow, you're advanced. Mix CDs. Yeah.
Yeah, like it's exactly the same thing as mixtapes, but digital form.
Yeah, right. In your intimate relationship at the moment, what's important for you? Music would be up there, would it?
In the relationship specifically,
Yeah.
I I don't
What's
know.
some values that are important to you?
Yeah, I guess the value that's important is like honesty and communication and
Yeah,
vulnerability.
nice.
And I guess just reflecting on it now, music can encapsulate all of that.
Mm.
Um, but I think I do sometimes have a tendency to, if it's not a musical setting, I don't really try to bring a lot of music in into lots of settings that aren't really, musical. I think there are some people who are just so musical to their bones, and they'll sing into the kitchen and but I'm definitely not that sort of person. So yeah, I guess when you ask the question, my first response is to not really have music as a part of it, but if I think enough about it, I can totally see how it's a special part of making the relationship more special beyond those core traits that I've already mentioned. Because
Mm.
yeah, like if I think of some amazing like moments and memories of the shared relationship, like they will inevitably go back to a lot of musical moments and memories
Mm.
um and yeah, there's a lot of I'm obviously very biased, but I feel like you can hear you can really get to the core of who someone is through the way that they might sing, whether
Oh,
they and the way that their voice sounds.
okay.
Like we've done a lot of karaoke together, even from before we were together.
Yeah.
And I actually feel like those moments were times when I got to see glimpses of her that I wouldn't have been able to see without the music.
Mm.
Because and I guess I'm getting a little bit psychoanalytic about it, but I do believe in it. Um, I do believe there's something in that with, the body is holding, whether it's tension or nervousness or inhibition, and then you're expressing that through the song, and um, yeah, it's just so vulnerable and revealing. Um, yeah, hearing someone sing or be musical. Yeah.
Mm. Yeah. But I also have heard that, like you only really sing it or, dance when you're actually quite comfortable, when you're relaxed and you're not sort of thinking about all those problems.
Yeah, I mean, I have never really like heard that explicitly, but I can totally imagine that to be true. But I guess I would contend that there's so many different ways to, I guess, trick yourself into being comfortable. Like I've never really been comfortable singing in front of people, but when it's my job, I'm totally comfortable doing it.
Yeah.
Um, or or if someone is, yeah, like if a child is there and it seems to me that that's what would make them feel better, it's so easy for me to feel comfortable to do that. Um, yeah, I guess I'm just saying what most other people's also feel. What most other people will also feel, but yeah.
Mm. Yeah. They say that it's really good for you actually to sing too, or even hum. Like people who hum and stuff. Yeah, they're much. I don't know. I've forgotten what the expression is, but yeah, they're kind of getting that dopamine, and yeah,
Yeah, definitely.
it's really
There's
good.
a lot around well, it kind of, I guess, really I guess, primes your nervous system a bit with all the breathing that you're doing. And
Yes.
there's a lot of work. Diane Austin is a practitioner from the States who does a lot of work around toning, she calls it. It's kind of like humming and making sounds, and that's a very informed way, actually. She uses that to work with people who are seeking music therapy to work through trauma and things like that. So yeah, there's definitely a lot about it that's and also having someone sing with you about things that are meaningful to you, breathing at the same time with people, like being in tune with people, like it's so validating in a way.
Yeah.
Yeah.
And so what other benefits are there for music therapy?
I guess I've tried to not speak as myself in the therapeutic context a lot because I'm trying to present things objectively or whatever. But yeah, I guess in answer to your question, for me, the biggest focus in a session is about hearing and seeing people in the way that they want to be seen, and validating their choices, and really just connecting with them authentically.
Yeah.
There are a whole host of competing factors that will always influence the different ways that we need to report on what's going on in our session. And I'm not saying that we fabricate those things. Those things are definitely happening. And I feel confident about those things that might be like functional goals or, speech goals or something like that, communication goals, expression goals, regulation goals. Those things are all happening. But I guess for myself, I really, my lens that I approach sessions is to really connect with them and and not try to fix people.
Yes.
It's a funny way to put it.
Yeah, no, I know what you mean though.
Yeah, and to not pathologize whatever, like a diagnosis.
Sort of
I
overthink it.
find a lot of people are really, really eager to share the diagnoses.
Oh, okay.
And I understand why. And it can sometimes be helpful if you're going in blind to a session, if you're going in without knowing anything. But at the same time, it really doesn't change anything about what I will do once I meet the person. Because one person with autism is just one person with autism. So you can't assume anything else about the next person that I'm working with autism.
Yes.
So yeah, I guess that's kind of what I'm saying. There's a lot of behaviors that people might present with that are atypical or abnormal in terms of putting it in a worse way. But I guess yes, in certain contexts, it can be really helpful, and sometimes it's what people want. It's that they want to maybe not have to do those types of behaviors all the time. But my personal belief is that we can meet those outcomes not by pathologizing those behaviors, but by actually validating and helping someone feel really comfortable in terms of who they are. And then there will be all of these other unintended but also not unexpected outcomes that also improve in a much broader way.
Yeah, so it's sort of like not over conceptualizing and thinking about it too much, more like following your heart about, because
Yeah,
I mean that's
I
what
really
music
think it
is like,
is.
isn't it? Music
Yeah.
is following your heart.
Yeah. Like when I hear you say that, I know you're right and I agree with you. But I guess there's a part of me that is a little bit afraid well, not afraid, but just a little bit hesitant because I don't want anyone to go away thinking, you know, music therapists are just do what they feel, and and that's not it. Like we have these feelings built upon our years of training and the research that has
Oh,
been
of
done.
course. Absolutely.
And I don't want to sound like a robot saying that, because, and I guess that's why I preference all of those things about the personhood and
Yes.
um. But yeah, it's hard to strike a balance, especially when you're trying to,
Well, and
just answer some questions in a way that
yeah,
represents you and the
and
profession fairly.
yeah, and you're a teacher, so your studies have been based on facts, and that's what you do as a teacher. Like that's where you come from.
Yeah, I guess one of the things that I was fearful of in terms of changing professions was that it would be like too um, ethereal or
Yeah.
not grounded enough in facts or something. But I've just totally found that it's not that everything is factual, it's that everything is not factual in a way. Like teaching is just as airy fairy and ethereal, if you think about it in a certain way, um
Well,
as therapy is. It's just that teaching
yeah.
has been presented in a certain light.
And I mean, there's a lot of guidelines, but one teacher delivers the same subject matter completely different to another teacher. So
Yeah.
there is always your personal element that's involved in it, your angle, your background, your history, um, your learning style, and how you've been taught. So many different facets to that. And it's like as a chef, like you give a recipe to one person and give it to another person and you get a completely different result.
Yeah. Yeah, exactly.
Yeah. Yeah. So everybody puts an element of themselves into everything.
Yeah. Yeah, I think that's exactly it.
Mm. And so can it help with speech, like with, oh, you said with a stutter. So when somebody sings, it's like when you hear music and you don't hear an accent, like an American song. Sometimes you
Hmm.
you don't determine that they are from the States, and so sometimes people will have a stutter when they talk, but then they lose it when they sing.
um yes to the last part about like people, there's so many cases of people who, yeah, can sing very comfortably, who might struggle to get through a few words in a sentence,
Mm.
um, in
So
certain situations.
can you pick something out of that? Like, what is that yeah, the brain is telling us that makes that
Well,
situation different?
I think that I'm not sure that they've been able to like conclusively say this is exactly it, but what they've been able to show in like brain imaging studies and stuff is when someone is talking, it's a very specific part of the brain that's lighting up.
Mm.
Um, and when someone is singing a song, it's those maps that you see of brains kind of lighting up and
Yeah.
firing in lots of different areas. So one
Oh,
of the
so
theories, I
they're
suppose, and
using more areas of their brain. Is that right?
yeah, yeah.
Okay.
So like I described before, when you're singing, you're not just talking, you're listening to all the other parts that are going
Mm.
on in the music, and you're responding to it and you're adding to it. And you're also tweaking what you're singing to what you're hearing in the music, little fluctuations in the volume and speed and all of that sort of stuff. Um, so so yeah, they have been able to show that quite, like that's a known thing.
Mm.
I guess what I don't know for sure right now, speaking off the top of my head, is my understanding at the moment is that that is just one way that they can represent and try to explain this has perhaps got something to do with why the stutter goes, but I'm not sure how I'm not sure that they've been able to identify this is the exact link that makes people not have to, I don't
Yeah.
think we're at that.
No. But so if somebody that had that affliction then did that plenty of times, actually sung, and would that train their brain to eventually get rid of it?
So in that case, I don't actually know of cases of someone just being able to completely say, yes, singing cured me of
Okay.
the affliction. But what I guess that is an example of us talking about plasticity, like neuroplasticity in the brain.
Yes. Yes.
And, not just for people who have acquired brain injuries and are going through rehabilitation, but definitely, strongly relevant in those situations as well. Because of that effect that I talked about just before with music using so many different areas of the brain, we can really take advantage of the plasticity of the brain to, I guess, encourage the most either rehabilitation or stimulation of the brain to whether it's, for patients with dementia and to try to slow the degeneration of brain function. It could be, like I mentioned, with people with acquired brain injuries and regaining their mobility and ability. There's lots of studies that have been able to show that musical interventions in earlier acute parts of people's rehabilitation do seem to have an effect on the rate of progression for people's recovery. And we can even talk about mental health, where brain scans of people with depression show less activity in different parts of the brain. And so, again, we're trying to use that lens of neuroplasticity to say music is a way, without having to pump someone full of, dopamine in artificial ways or whatever, that we can actually try to stimulate and promote those connections in the brain and stuff like that.
Yeah, fascinating. Yeah. Yes, music is very powerful. So is there anything else you'd like to add?
Yes, it's been helpful to have the questions that you've asked, because, I guess based on the way that I think about the topic of music and the way that it can be used with people, we can just take it in so many different ways.
Yes.
So I guess for any listeners, the biggest takeaway I would hope for people is not the facts that I might have happened to have listed off, but it's more just of the variety and the potential of music and the different ways that we can engage with it if we are motivated and choose to do so. That's the power of music. It's not that we can prescribe music as a medicine to just be like, that's why it's so magical and beautiful. It's not that. It's all of the opportunities that we as humans just happen to have come up with so many different ways of using music in so many different contexts and places with different people, different stages of life. And that, I think, that is the magical thing about it, which is not magical at all, really. I would hope that. And again, I feel like I've kind of waffled around it, but it's just because there's so many
No,
things happening in my
I love
brain that
that.
I find it really
That's
hard to
really good.
boil it down
Yeah.
to one thing. Yeah.
Yeah. Yeah. Like I just keep coming back to nostalgia for me. You know, music is so connected to my past. It sounds funny, but that also motivates me for the future too.
Yeah, yeah, exactly. So nostalgia can really go. Well, when we talk about nostalgia, it's mostly positive, isn't it? But for some people, it can also bring different feelings of sorrow.
Mm.
And maybe that's one area that we haven't talked about music therapy as well, is in palliative care, and there's a lot of work around legacy, kind of work of working with people in their palliative stage to create almost like artifacts for the family, like whether they are writing a song together or compiling some songs to
Oh,
leave a
how
message.
beautiful.
There's a lot of work happening there that I haven't quite had the privilege of um, delving into myself, but I know that there's lots of people, lots of practitioners doing awesome work in that area too.
Oh, that sounds amazing. Mm.
Yeah.
So would they're just like compiling something, and how do you write a piece of music like that?
Um, so you would work a lot with the family. You would work with the person, depending on, on whether, I guess, what stage they're at and whether
Mm.
they're able to still kind of respond and contribute ideas and things like that as well. Um, but yeah, if I guess for some people, they they might have whatever condition that they know they're going to deteriorate quickly, but they're still at the stage of being able to engage with everything as long as someone comes to them and helps them through
Yeah.
whatever needs they have. Um,
So is it like putting down words? Is it or the tunes? Like is it a riff that they like or
yeah, it could be any of that.
mm.
So if, lots of people that I've worked with who are in aged care are extremely musical. They
Yeah.
happen to have all sung or played it and grown up in
Mm.
churches and things like that. And so many of them can like sing a musical idea that you can turn into a song together. I've worked with people who have just written a lot of their own songs and they just need someone to be able to put some music to it and record it.
Oh
So that
wow.
might be a part of
Yeah.
the work too. But there might be some people who aren't musical at all, but just have a favorite song that they would like, their voice to be in, maybe. Maybe the family are gonna um, would yeah, maybe there's like some sort of collaboration thing happening where everyone kind of gets together and has an opportunity to work towards one final kind of, I guess, project, a collaborative
Yeah.
project together.
Oh, that would be amazing. So
Yeah.
cool. Mm. Okay. Well, I've found this very enlightening and it is a really interesting topic. And I can see the benefit to so many different people. And your work is really, I don't know, it's so beautiful to hear that there is these types of therapies that aren't. How long has it been going for?
It's been around a while, since
Mm,
about the 50s, I think.
okay.
That's
Yeah,
really tested me, but it looked a lot different. It was,
I bet.
I think they kind of happened upon it with war veterans, and they
Mm.
realized that people were responding quite well to. And that's another massive topic, pain management.
Hey, yeah.
Like people were responding really well to hearing music, and so they were like, "Oh, there might be something in this," and yeah, it kind
Mm,
of started off in the States. I guess, found its footing more recently in Australia. Um,
mm.
but there's, like we talked about, the receptive methods, and um, there's one of the kind of pioneers of guided imagery. And music is based in Australia, and I guess Australia has been a, at the forefront of really embracing music therapy as a part of services
Mm.
that people in society can more readily
Access.
access. There's a long
Yeah.
way to go.
Yep.
Like we would love for us to be included in like Medicare
Mm.
bulk billing, or for private insurance users to be able to access it and stuff like that. But being approved as part of the NDIS was a massive step.
Absolutely.
That was really validation for the research that's been done in the area and everything.
Mm.
And yeah, I guess the other changes will come soon.
Yeah. It totally makes sense for that to be the case. Yeah. Who was the pioneer you were saying in Australia?
Uh, Helen Bonny was the pioneer, but there is Denise Grocke.
Okay.
Denise Grocke is the person who, really leads the training for GIM, and that's where it's a lot more, I guess, psychoanalytic, where people listen and go through a meditative experience. They might go through an imagery thing. They talk through things as they listen to different pieces of music. They might draw what they saw, then they talk
Mm.
about it with the therapist, that sort of thing.
Mm. Wow. Using more than your listening, yeah, more senses. Using
Mm.
your imagination, your visual. Yeah.
Yeah, yeah,
Mm. Incredible.
yeah.
Well, thanks for your time today, Phil. It's been wonderful. Yeah.
Yeah, thanks for having me on.
Mm. No problem.